Pharmacology. Respiratory. Anticholinergics. Ipratropium is an example of a short-acting anticholinergic. Tiotropium is an example of a long-acting anticholinergic. Additional information regarding anticholinergics can be found in the Autonomic Nervous System chapter. Tiotropium is a long-acting anticholinergic. Mechanism of action. Anticholinergics block the action of acetylcholine in bronchial smooth muscle, which reduces bronchoconstrictive substance release. Indications for use. Anticholinergics are used for maintenance therapy of bronchoconstriction associated with asthma, chronic bronchitis, and emphysema. Adverse effects. Anticholinergics should be used with caution with the elderly and can cause cough, drying of the nasal mucosa, nervousness, nausea, GI upset, headaches, and dizziness. Patient education. Patients should be instructed to use the inhaler as directed and be careful not to exceed dosage recommendations. They should receive education regarding the onset of medication and differences in usage for short and long-acting anticholinergics. Some long-acting anticholinergics may cause signs of angioedema, and the healthcare provider should be notified if this occurs. Corticosteroids. Corticosteroids can be prescribed in a variety of routes. Fluticasone is an example of a commonly used inhaled corticosteroid. Prednisone is an example of a commonly used oral corticosteroid. And methylprednisolone is a commonly used IV corticosteroid. Additional information about corticosteroids and potential adrenal effects is located in the endocrine chapter. Mechanism of action. Fluticasone is a locally acting anti-inflammatory and immune modifier. The nasal spray is used for allergies, and the oral inhaler is used for long-term control of asthma. Fluticasone is also used in combination products with salmeterol. It decreases the frequency and severity of asthma attacks and improves overall asthma symptoms. Oral prednisone prevents the release of substances in the body that cause inflammation. It also suppresses the immune system. Methylprednisolone IV prevents the release of substances in the body that cause inflammation. It also suppresses the immune system. Methylprednisolone requires reconstitution before administration. Indications. Fluticasone inhalers are used to prevent asthma attacks. In respiratory conditions, oral prednisone is used to control severe or incapacitating allergic conditions that are unresponsive to adequate trials of conventional treatment for seasonal or perennial allergic rhinitis. Bronchial asthma, contact dermatitis, atopic dermatitis, serum sickness, and drug hypersensitivity reactions. Methylprednisolone IV is used to rapidly control these same conditions. Considerations. Fluticasone is safe for 4 years and older. Prednisone and methylprednisolone are safe for all ages. Adverse effects. Fluticasone can cause hoarseness, dry mouth, cough, sore throat, and oropharyngeal candidiasis. Patients should rinse their mouths after use to prevent candidiasis or thrush. Prednisone and methylprednisolone cardiovascular symptoms can include fluid retention, edema, and hypertension. Imbalances such as hypernatremia or increased sodium, hypokalemia, decreased potassium, and increased blood glucose with associated weight gain can occur. CNS symptoms include mood swings and euphoria. GI symptoms can include nausea, vomiting, and GI bleed. In long-term therapy, bone resorption occurs, which increases the risk for fractures. The skin may bruise easily and become paper thin. Wound healing is delayed, infections can be masked, and the risk for infection increases. Long-term corticosteroid therapy should never be stopped abruptly because adrenal insufficiency may occur. Methylprednisolone requires reconstitution before administration. Patient education. Patients should be advised that corticosteroids are not used to treat an acute asthma attack. They can cause immunosuppression and suppress signs of infection. Corticosteroids can also cause an increase in blood glucose levels. Patients may experience weight gain, swelling, increased fatigue, bruising, and behavioral changes. These occurrences should be reported to one's healthcare provider. Leukotriene receptor antagonist. Montelukast is a leukotriene antagonist medication with a distinctly shaped tablet. Mechanism of action. Montelukast blocks leukotriene receptors and decreases inflammation. Indications for use. Montelukast is used for the long-term control of asthma and for decreasing the frequency of asthma attacks. It is also indicated for exercise-induced bronchospasm and allergic rhinitis. Considerations. This medication is safe for children 12 months and older. It is available in granule packets and chewable tablets as well as regular tablets. Adverse effects. Montelukast can cause headache, cough, nasal congestion, nausea, and hepatotoxicity. Patient education. Patients should be instructed to take medications at the same time each day and at least 2 hours prior to exercise. They should not discontinue medications without notifying the healthcare provider. Xanthene derivatives. Theophylline is a xanthene derivative. Mechanism of action. Theophylline relaxes bronchial smooth muscle by inhibition of the enzyme phosphodiesterase and suppresses airway responsiveness to stimuli that cause bronchoconstriction. Indications. Theophylline is used for the long-term management of persistent asthma that is unresponsive to beta agonists or inhaled corticosteroids. Adverse effects. Theophylline can cause nausea, vomiting, CNS stimulation, nervousness, and insomnia. Patient education. Patients should be sure to take medications as prescribed at appropriate intervals. They should avoid irritants and drink fluids to help thin secretions. Patients will need serum blood levels tested every 6 to 12 months. Allergies. Glossary. Allergies occur when the immune system reacts to a foreign substance and makes antibodies that identify a particular allergen as harmful, even though it isn't. Anaphylaxis. A severe, potentially life-threatening allergic reaction can occur within seconds or minutes of exposure to something you're allergic to, such as peanuts or a bee sting. Cyanotic, bluish or purplish discoloration of the skin due to deficient oxygenation of the blood. Gas exchange, the process at the alveoli level where blood is oxygenated and carbon dioxide and waste product of cellular respiration is removed from the body. Pallor, a deficiency of color, especially of the face, or paleness. Paradoxical effect, an effect that is the opposite of what is expected. Sputum, matter expectorated from the respiratory system and especially the lungs that is composed of mucus and may contain blood, pus, fibrin, or microorganisms such as bacteria in diseased states. Respiratory rate, the total of number of breaths or respiratory cycles that occur each minute. A child under 1 year of age has a normal respiratory rate between 30 and 60 breaths per minute. But by the time a child is about 10 years old, the normal rate is closer to 18 to 30. By adolescence, the normal respiratory rate is similar to that of adults, 12 to 18 breaths per minute.